Good morning, all of you. Today we are going to start the second unit. As far as the second unit is concerned, there are 5 topics has to be covered. One is determinants of health, then components of health program, and the third one is spatial distribution of healthcare facilities, and the fourth topic is pricing of health services, and fifth topic is multiple services of an hospital. Today we are starting with determinants of health. There are 5 major determinants of health, which are: the first one is genetics, which plays a dominant role in health level, and second one is behavior, the third one is environmental and physical influences, and the fourth one is medical care, and finally the fifth one is the social factors. So what are the major determinants? Genetics, behavior, environmental and physical influence, and fourth one is medical care and social factors. Now we start with the what different agencies have given about the determinants of health. It is a very complex interaction because it not only the individual is involving, it is a community is involving. The two, it is played with the social and economic factors, and to some extent the behavior also play a dominant role. So the determinants is a complex study. So now I am mentioning a public health agency of Canada which identify 12 determinants. What are they? Number one, income and social status, which play a dominant role in health. The second one is social support network. The third is education and literacy. The fourth one is employment and working condition of the people. Next, the social environment. The next one is physical environment. The personal health practices and coping skills also play a dominant role in the health level. And healthy child development is an inevitable part in the determinants of health. Yes. சொல்லுங்க. கரெக்டாப்பா. நான் இப்ப கொஞ்சம் கிளாஸ்ல இருக்கேன். ஒரு 1/2 hour கழிச்சு லிங்க் பண்றியா? The fifth factor is social environment. The sixth factor is physical environment. The seventh factor is personal health practices and how we are coping with the health skills. And the major factor is considered to be the healthy child development, because if you done it, definitely the health level will be improving. The major one more major factor is biology and genetic endowments, because these are all in our hands. If father and mother is having a sugar, definitely you are bound to get the sugar. So the next factor is what type of health services has been rendered. Then the 11th factor is gender and 12th factor is culture. These 12 factors are considered to be the determinants of health according to Public Health Agency of Canada is concerned. Then what World Health Organization is saying, there are many determinants for health, but which are categorized in 3 categories. One is social environment, the second one is economic environment, and finally the physical environment. All these factors are covered in this. Those who are not covered here, it will be treated as a personal individual character or behavior. So even though there are many determinants, I am listing only the 10. The first one is income and social status. Higher the income, the social status, definitely there will be a better health. Why? Because there is a greater gap between the richest and poorest people. Definitely, if the rich can able to afford a good medical treatment rather than the poor one. That is why the income and social status improve their health. So this is a major determinant. The second one is education. Suppose the people are not educated, very low level of education, which definitely influence the health. There will be a poor health and more stress and lesser self-confidence. All these things will be there. Therefore, the health will be deteriorated. The third factor is physical environment. Suppose we don't have a safe water or clean air and not proper working place, very dirty environment. All these things definitely will deteriorate your health. Instead, there will be a safe water, clean air, healthy workplace, safe houses and communities, and proper infrastructure. All these things will improve your health. Not only that, even those who are employed, the working condition of the employee definitely improves it. Suppose those who are working in leather industry, a lot of chemicals, very polluted air, polluted water. Because of that, they will be always sick. So even the working condition of the people should be good. Then only health will be improved. The next factor is social support network. Greater the support of family, friends, and communities, definitely it will improve the health. Why? Because if you have a proper friendship and a proper community, and there will be an improvement in the health. Suppose rather it is not present, definitely your health will be deteriorated. The major factor related with the social support network is culture. Suppose we have a proper tradition or proper custom and there is a hard and fast rule for following the thing, definitely it will improve your health. Bad habits always deteriorate your health. The uncontrollable determinant is called genetics. The inheritance plays a major role in your determining the lifespan. Why? Because the healthiness and likelihood of lifestyle definitely will improve your health. Definitely, the illness will be evaded. The personal behavior is also important determinant because balanced eating, keeping active, non-smoking, non-alcohol. If you are becoming a teetotaler, definitely your health will be good. Rather, there will be a improper diet, always lazy, and you are a chain smoker, and you are not having many bad habits. Definitely, it will deteriorate your health. There will be a stress in your life, and it will affect all the health problem you want to get. The next best determinant is health service. How much service you can able to avail within your place. Definitely that improve your health. Suppose nearby there is a clinic or hospital, availability of paramedical facilities and other health centers are there. Definitely your health will be improved. One more thing is the disease is different from men to women. There are some diseases or some health problem for the men, some health problem for women. These two are not same. Depending upon the gender, the problem may differ. Uh, in this class, I want to give two research studies. One given by Bhushan uh, Patwardhan. I'm not able to read his name, but his article is really good. There are five factors, major factors you have mentioned: genetics, environment, medical care, nutrition, lifestyle. Out of five, the genetics, environment, and medical care is not in our hands. But the other two, what are the other two? The nutrition and lifestyle. Interestingly, these two determinants, they are totally in our hands only. Hence, we are called, it is called modifiable factor. These two determinants are modifiable. Many diseases are caused by the bad practices in the nutrition and the lifestyle. The degraded ecosystem and environmental pollution causes a several disaster, and because those things are not in our hands. But your lifestyle and your diet system, it is in your hands. If it is proper, definitely you can improve your health. And he mentioned in his conclusion, there are five major factors: biological, behavioral, social, cultural, economical, and ecological. These five factors definitely determines the health, which is divided into four categories: nutrition, lifestyle, environment, and genetics. Because here there are four categories, there are five fields. Joined together, we can make a perfect health system. That's what he concluded in his research. And one more research article is by Lawrence. He submitted his research article, the model of Earth System and Environmental Science in 2014. He clearly mentioned a flowchart based on the lifestyle behavior. And in this lifestyle behavior, there are seven factors which influence. One is material and social factors. Second one is how the government is implementing their health policies. So national and local policies. What type of information media is available? That is, literacy level also play a dominant role. Then the fourth factor is education and employment. The last factor is the family biography, genetics. What I mean, the demographical factors will be these seven factors may improve your lifestyle, and which in turn will improve your health status. This flow chart is very clear, and the statements given by Lawrence is really appreciable. The as far as our portion is concerned, that is 5 possible questions are available. Number one, a section A question, what are the major determinants? Number two, why it is important? And coming to section B, there are 2 possible section B is available. What are the economic determinants of health? And what are the social determinants of health? These 2 section B is possible. In section C, you have to explain the determinants of health, not only the major but also the flow chart, the economic determinants, social determinants, and what are the health hazards for improving the health. All these things you have to write in the section C. Definitely you can score good marks. So this particular flow chart shows what are the core economic determinants of health. Number one, employment and working condition. Number two, education and literacy. And number three is physical environment. I think all these things just now I have explained. The fourth one is social support network. Then personal health practices and coping skills. And sixth one is social environment. All these things is not in our hands. Then what is in our hands is this six. It's a modifiable factor, majorly the nutrition and the lifestyle. Apart from that, there are what type of health services is available in your locality. Then gender, that is a major factor which improve your health status, and financial and social status also improve because the rich are having a better health than the poor. Then custom cultural factors will be there. If elders are there in your home, definitely your health will be improved because they will be very cautious and they will ask you to practice a good health system. And these are all the major economic factors for the health. Coming to the next one, before explaining about the social determinants, but we should know what are the health hazards relating with the health. Health hazards, we should say. If there is a environmental pollution, definitely your health will be deteriorated. Lack of education, inadequate food and nutrition, unemployment problem, poor housing, poverty line. These are all the factors. Even though it is an economic factor, it affects as a social factor. So these are the health hazards relating with the determinants of health. Now, this particular flowchart gives what are the social determinants. Social determinants, social support, and how you are coping with the skill, how accessible the health service, what are all the healthy behaviors, what is the social environment, whether this physical environment coping with the social environment, what is your social status and income status. These are the determinants as far as the social determinants of health is concerned. With this, I am concluding the class. May God bless you, my children. On or before 14, please complete your classwork. From 21st onwards, you are having second CA. What are all so far we are covered, that will be the portion for the second CA. All the best. May God bless you. If you have any doubt, you can ask me.